Good day everyone, I'm Arlene J. Lopez from Bachelor of Science in Midwifery 1B. This time I will discuss the microbial disease of cardiovascular and lymphatic system. Infection from animal reservation transmitted by direct contact. There are two similar but distinct diseases. In North America, the more common disease called Streptobacillary rat bite fever is caused by Streptobacillus moniliformis. When the pathogen is ingested, the disease is in term Haverhill fever. This is filamentous, gram-negative, highly pleomorphic, fastidious bacterium that is difficult to culture. Although isolation to culture is the best diagnostic method. The symptoms are initially fever, chills, and muscle and joint pain, followed in a few days by a rash on the extremities. Occasionally, there are more serious complications. If untreated, mortality is around 10%. Infection transmitted by vectors. We have here some diseases, and the first one is plague. Plague is a few diseases have affected human history more dramatically than plague, known in the Middle Ages as the Black Death. This term comes from the one of its characteristics. The dark blue areas of skin caused by hemorrhage. The disease is caused by gram-negative, road-shaped bacterium. Yersinia pestis, normally a disease of rats. Plague is transmitted from one rat to another by the rat flea. Sinophysalia shopis. You can see in the picture the example of case of bubonic plague. A bubonic plague is caused by infection with Yersinia pestis. This photograph shows a bobo, swollen lymph node on the thigh of the patient. Swollen lymph nodes are common indication of system infection. From the flea, bacteria enter the human's bloodstream and proliferate in the lymph and blood. One factor of the violence of the plague bacterium is the ability to survive and proliferate inside phagocytic cells rather than being destroyed by them. An increased number of highly virulent organisms eventually emerge, and overwhelming infection results. The lymph nodes in the groin and armpit become enlarged, and fever develops as the body defenses react to the infection such as feelings called bobus, account of the name bubonic plague. This is the most common form, comprising 80-95% of cases today. Death, if it occurs, is usually within less than a week after the appearance of symptoms. A particularly dangerous condition called septicemic plague arises when the bacteria enter the blood and proliferate. Plague has been commonly diagnosed by isolating the bacterium and then sending it in the laboratory for identification. A rapid diagnostic test, however, it can reliably detect the presence of the capsular antigen of Y. pestis in blood and other fluids of patients within 15 minutes, even under remote field conditions. People exposed to infection can be given prophylactic antibiotic protection. A number of antibiotics, including streptomycin and tetracycline, are effective. Recovery from the disease confers reliable immunity. A vaccine is available for people likely to come into contact with infected fleas during field operation or for laboratory workers exposed to the pathogen. We have here another disease as what we call relapsing fever. Except for the species that cause lymph disease, all members of Escherichia genus Borrelia cause relapsing fever. In the United States, the disease is transmitted by zoonotics that feed on rodents. The incidence of relapsing fever increases during the summer months, when the activity of rodents and arthropods increases. The disease is characterized by fever, sometimes in excess of 40.5 degrees Celsius, jaundice, and rose-colored skin spots. After 3 to 5 days, the fever subsides. 3 or 4 relapse may occur, each shorter and less severe than the initial fever. Each recurrence is caused by a different antigenic type of spirochete, which invades existing immunity. We have another kind of disease, what we call Lyme disease or Lyme borreliosis. In 1975, a cluster of disease cases in young people that was first diagnosed as rheumatoid arthritis was reported near the city of Lyme, Connecticut. The seasonal occurrence, lack of contagiosity among family members, and description of annual skin rash that appear several weeks before the first symptoms suggested a tick-borne disease. In 1983, a spirochete that was later named Borrelia burgdorferi was identified as the cause. Lyme disease is now the most common tick-borne disease in the United States. In Europe and Asia, the disease is usually known as Lyme borreliosis. Often, in these locales, the tick and Borrelia species differ from those in the United States. Tens of thousands of cases are reported annually. In the United States, Lyme disease is most prevalent on the Atlantic coast. The tick, one of the exotic species, feeds 3 times during its life cycle. The first and second feedings as a larva and the nymph are usually in the field mouse. The third feeding is an adult, usually on a deer. These feedings are separated by several months, and the ability of the spirochete to remain viable in the disease-tolerant field mice is crucial to maintaining the disease in the wild. The first symptom of Lyme disease is usually a rash that appears in the bite site. It is a red area that clears in the center as it responds to a final diameter of about 15 cm. This distinctive rash occurs in about 75% of cases. Flu-like symptoms appear in a couple of weeks as the rash fades. Antibiotics taken during this interval are very effective in limiting the disease. The image shows the life cycle of Lyme. First is an infective 6-legged larva hatches from egg and develops. Second is larva feeds on a small animal becoming infected with Borrelia burgdorferi. And number 3 is larva is dominant. Next, number 4, larva develops into 8-leg. It's what we call nymph. Nymph feeds on animal or human transmitting infection. Number 6, nymph develops into adult tick. And number 7, adult ticks feed on deer and mate. And last, number 8, female tick lays eggs. The image shows that the common bullseye rash of Lyme disease. The rash is not always this obvious. And we have another disease. It's what we call the ehrlichiosis and anaplasmosis. Human monocytotropic ehrlichiosis is caused by Ehrlichia schaffensis. This is a gram-negative, rickettsia-like, obligately intercellular bacterium. Aggregates of bacterium called morali, the Latin word mulberry, form within the cytoplasm of monocyte. E. schaffensis was observed in a human case in 1986. Previously, it had been considered a solely veterinary pathogen. HFB is a tick-borne disease. The common name for usual vector is Sloan starty. Cases occasionally occur where this tick is not found. So, there are vectors. The white-tailed deer is the main animal reservoir, but it does not show sign of illness. A similar tick-borne disease, human granulocytic anaplasmosis, was formerly called human granulocytic. Er- Ehrlichiosis, the change occurred when the causative organism, an obligate intercellular bacterium, formerly grouped with the Ehrlichia, was renamed Anaplasma phagocytopelum. Typhus. The various typhus diseases are caused by rickettsial bacteria that are obligate intracellular parasites of eukaryotes. Rickettsiosis, which are spread by arthropod vectors, in, infect mostly the endothelial cells of the vascular system and multiply within them. The resulting inflammation causes local blockage and rupture of the small blood vessels. Endemic marine typhus occurs sporadically rather than in epidemics. The term marine, derived from Latin from mouse, refers to the fact that the rodents such as rats and squirrels are the common hosts for this type of typhus. Endemic marine typhus is transmitted by the rat, flea Synoplasma shoepes, and the pathogen responsible for the disease is Ricket- Rickettsia typhi, a common inhabitant of rats. With a mortality rate of less than 5%, the disease is considerably less severe than the epidemic form of typhus, except for the reduced severity of the disease. Endemic marine typhus is clinically indistinguishable from epidemic typhus. Tetracycline and chloramphenicol are effective treatments for endemic marine typhus, and rat control is the best preventive measure. Next, we have another kind of disease that is spotted fevers. Tick-borne typhus or Rocky Mountain spotted fever is probably known as the rickettsial disease in the United States. It is caused by Rickettsia rickettsii. Despite name, it was first recognized in the Rocky Mountain area. It is most common in the southern states and Appalachia. This rickettsia is a parasite of ticks and usually pass from one generation of ticks to another through their eggs a mechanism called transovariant passage. Surveys show that the endemic areas, perhaps 1 out of every 1,000 ticks is infected. In different parts of the United States, different ticks are involved. In the West, the wood tick dermacenter, andersoni. In the East, the dog tick dermacenter variabilis. You will see in the picture the U.S. geographic distribution of Rocky Mountain spotted fever. The life cycle of the tick vector, the dermacenter of Rocky Mountain spotted fever. Mammals are not essential to survive of the pathogen. Rickettsia rickettsii in the tick population. The bacteria may be passed by transvariant passage, so new ticks are infected upon hatching. The blood meal is required for ticks to advance to the next stage in the life cycle. The image shows the life cycle of spotted fever. Number 1. An infective adult female tick dermacenter lays eggs. Number 2. Eggs hatch and six-legged larvae develop. Number 3. Six-legged larva takes blood meal from a small mammal, infecting it and develops into eight-legged nymph. Number 4. Nymph takes blood meal from human, infecting him of her, and then develops into an adult tick. And last, number 5. Adult tick takes another blood meal and mates. You can see that the life size of the tick. You will see the image. You will see the image. That is an example of the rash caused by Rocky Mountain spotted fever. This rash is often mistaken for measles. People with dark skin have higher mortality rate because the rash is often not recognized early enough for effective treatment. About a week after the tick bites, a muscular rash develops that is sometimes mistaken for measles. However, it is often appears on palms and soles, where viral rashes do not occur. The rash is accompanied by fever and headache, date which occurs in about 3% of the approximately 200 cases reported each year. Is usually caused by kidney and heart failure. Serological tests do not become positive until late in the illness. Diagnosis before the typical rash appears is difficult. Symptoms are widely also on dark skin. Individuals a rash is difficult to see. A misdiagnosis can be justified if treatment is not prompt and correct. The mortality rate is about 20%. Antibiotics such as tetracycline and chloramphenicol are very effective if administered early enough. No vaccine is available. Viruses cause number of cardiovascular and lymphatic diseases, prevalent mostly in the tropical areas. However, one viral disease is type infection mononucleosis is an especially familiar infection disease among American college-age individuals. We have here another kind of disease is that is Burkitt's lymphoma. In 1950s, Dennis Burkitt, an Irish physician working in Eastern Africa, noticed a frequent occurrence in children of fast-growing tumor of the jaw, known as Burkitt's lymphoma. This is the most common childhood cancer in Africa. It has limited geographic distribution, similar to that of malaria in Central Africa. Burkitt is suspected a viral cause of tumor and a mosquito. At that time, there was no known virus that caused human cancer, although several viruses were clearly associated with animal cancers. Interviewed by this possibility in 1964. British virologist Tony Esbeth Einstein and his student, Yoni Barr, performed biopsies on the tumors. A virus was cultured from his material and electron microscope showed a hair-spear-like virus in the culture cells. It was named the Epstein-Barr virus, EB virus. The official name of the virus is human herpesvirus 4. EB virus is clearly associated with Burkitt's lymphoma, but the mechanism by which it caused the tumor is not understood. Research eventually showed, however, that the mosquitoes do not transmit the virus or the disease. Instead, mosquito-borne malarial infection apparently foster the development of Burkitt's lymphoma by impairing the immune response to EV virus, which is almost universally represented in human adults worldwide. Like the virus has in fact become so adapted to humans that is one of your most effective parasites. It establishes a lifelong infection in most people that is harmless and rarely cause diseases. We have another kind of disease. It is chikungunya fever. There is the introduction of the West Nile virus into the United States has shown a total tropical mosquito-borne disease can spread in the temperate climate. Rapid travel and climate warming, among other factors, are making similar vector-borne disease a global phenomenon. Another tropical disease now causing concern is chikungunya fever. The name comes from an African language and means that which bends up. The symptoms are high fever and severe, clipping joints points, especially in the wrists, fingers, and ankles, that can persist for weeks or months. There's often rash and even massive blisters. The death rate is very low. The vector is Aedes mosquito, primarily Aedes aegypti, which is spread the disease widely in Asia and Africa. Recent outbreaks have also been caused by Albopictus, a mountain virus which is related to the virus causing Western equine encephalitis and Western equine encephalitis, classic viral hemorrhagic fevers. Most hemorrhagic fevers are zoonotic disease. They appear in humans only from infection contact with their normal animal hosts. Some of them have been medically familiar for so long that they are considered classic. Hemorrhagic fevers, first among there is yellow fever. The yellow fever is a virus infected into the skin by mosquito, Aegypti. In the early stages, the severe cases of disease, the person experiences fever, chills, and headache, followed by nausea and vomiting. The stage is followed by jaundiced yellow of the skin that give the disease its name. This coloration reflects liver damage which results to deposit of bile pigments of the skin and mucous membranes. The mortality rate for yellow fever is high, about 20%. Thank you for listening. I hope both of us was learned.